Breathing easy again. Why extubation matters. Written by Dr. Sanjay Gupta. Extubation. It sounds complicated, but it's simply the process of removing a breathing tube. This tube, called an endotracheal tube, helps patients breathe when they can't do it on their own. Think of it like a temporary bridge supporting a patient's airway. But just like any bridge, there comes a time for it to come down. Extubation marks a significant step towards recovery. It means the patient's lungs are strong enough to work independently. It signifies progress, a return to a more natural way of breathing. But the process requires careful planning and execution. Just like a bridge dismantling, we need to ensure stability every step of the way. The goal is a smooth transition from assisted breathing back to spontaneous breathing. This involves careful assessment, meticulous preparation, and constant monitoring. Every breath counts, and our job is to make each one count as the patient transitions to breathing on their own. Ready, set, extubate. Checking off the essentials. Before we even think about removing the breathing tube, we need to make sure the patient is truly ready. This isn't a decision made lightly. We look for specific signs that indicate the patient's lungs are up for the task. These include stable breathing, adequate oxygen levels, and minimal reliance on the ventilator. Think of it like a checklist. Can the patient breathe comfortably on their own? Are their vital signs stable? Do they have enough strength to cough and clear their airway? These are all critical questions we need answered before proceeding. Beyond the patient, we equip ourselves with the necessary tools. Suction equipment is crucial for clearing any secretions. Oxygen therapy should be readily available to provide support if needed. And of course, monitoring equipment helps us keep a close eye on the patient's vital signs throughout the process. Pre-game prep, setting the stage for smooth sailing. With the patient deemed ready and equipment in place, we enter the pre-extubation phase. This involves optimizing the patient's ventilation and ensuring a clear airway, crucial steps for a successful extubation. We want the patient to be in the best possible shape before the breathing tube is removed. First, we fine-tune the ventilator settings, gradually reducing the level of support. This allows the patient's lungs to gradually take over the work of breathing. Think of it like slowly removing weights from a barbell, allowing the muscles to adjust to the decreasing load. Next, we focus on clearing the airway. We suction secretions to ensure a clear path for breathing once the tube is removed. This is like clearing any debris from a road before opening it to traffic, ensuring smooth and unobstructed passage. The main event, saying goodbye to the breathing tube. With meticulous preparation complete, we move to the extubation itself. This step-by-step process requires a calm and coordinated approach. It's like a choreographed dance, each movement executed with precision and care. First, we pre-oxygenate the patient, providing them with a boost of 100% oxygen. This creates a reserve, like filling a car's tank before a long journey. Next, we deflate the cuff of the endotracheal tube. Imagine a balloon losing its air, allowing for easy removal. With the cuff deflated, we gently remove the tube, instructing the patient to cough as it comes out. This cough helps expel any remaining secretions. Finally, we administer oxygen through a mask or nasal cannula, providing supplemental support. After the tube, keeping a watchful eye. Extubation may be complete, but our job is far from over. The post-extubation period is crucial, demanding vigilance and proactive care. Just like a bridge needs monitoring after dismantling, we keep a close eye on the patient, ready to intervene if needed. We continuously monitor vital signs, including heart rate, respiratory rate, and oxygen saturation. Any signs of distress, like difficulty breathing or a drop in oxygen levels, require immediate attention. It's like having a finger on the pulse of the situation, constantly assessing and adjusting. Beyond monitoring, we provide support to ensure the patient's comfort and well-being. This might involve pain management, airway clearance techniques, and reassurance. The goal is to provide a seamless transition back to independent breathing and a sense of calm and security for the patient.